morning, everybody. I'm Dr. Behram Pardiwala. I'm the Chief of Medicine at Wockhardt Hospital, South Mumbai, and I'm also the Director of Academics of the same hospital. I hope that in these times of COVID-19, you are all keeping well. This COVID-19 is an extremely novel disease which all of us have faced for the first time in our life. And therefore, there are a lot of speculative reports going about regarding COVID-19 and diabetes, the connection between the two, and ultimately what happens. I am here today to discuss the steps that you should take in your life to control your disease and to prevent this correlation between COVID-19 and diabetes. Try and understand. It is true that people with diabetes, people with hypertension, people with cardiometabolic diseases, people who are smokers, people who are chronic lung disease, people over 65 are more prone to get the virus infection and have a poorer prognosis. But at the same time, what I must emphasize is that you should not panic. Unnecessary panic decreases your immunity, and by decreasing your immunity, that is the thing which will help you fight the disease. So please understand, don't panic. The first thing you must understand is your blood sugar needs to be under absolute control. That is extremely important. And it has to be under control throughout the 24 hours. Your fasting should be between 110 and 115 milligrams, and your postprandial should always be below 160 milligrams. You must maintain a meticulous blood sugar chart, self-monitoring of blood glucose, which I've often told some of my patients. If you do that, the chances are that diabetes and that correlation between diabetes and coronavirus will not play such an important role. Similarly, for other diseases, if you control your blood pressure, etc., you will be able to do well. You must understand that you need to control your diet. Take your meals at the regular time as has been prescribed to you. Avoid high-calorie snacks. You know, whenever in this sort of a situation, when you're cooped up with the family, one always tends to go for taking snacks. And what are our Indian snacks? Usually our Indian snacks are deep fried, laden with salt, etc. Try and avoid that. If you must snack, snack on cucumber sticks. Snack on tomato, raw tomato. Snack on some fruits. Take an apple, take an orange. That would be better. But overall, try and keep your diet within limits. As far as caffeinated drinks are concerned, try and reduce the intake, especially caffeinated soft drinks. Those are an absolute no-no in these situations. You must keep adequately hydrated. That is one of the most important things. Avoid extremely hot water or extremely cold water. Room temperature drinks would be perfect. Please remember to take all your medications properly. That is something which is extremely important. You must take all your medications regularly as you were prescribed right in the beginning. Remember the aspect of exercise. Exercise is important for every diabetic individual, and it is no different in this time of COVID-19. You should continue your exercise program that you have been doing. It is essential that you continue it. And 150 minutes of exercise a week, which translates into 22 minutes a day. I don't think it should be difficult for you at all. And you don't need to do very high-end exercises. Simple walking. If you are prevented from walking in your society premises, simple walking in the house, in the corridor, wherever would do you good. Yoga would also play a very important role. because it calms you down. And yoga has various other benefits. Why am I so emphasizing your diabetes and exercise? It's because when you exercise, you have a secretion of hormones, which are feel good hormones. And the more you exercise, more secretion of the hormones that you have. And not only that, but it also burns off excess calories. So it helps you maintaining your ideal blood sugar. Just like your schedule of eating, working, exercising, you need to have a regular sleep pattern also. You have to maintain your regular circadian rhythm. That is extremely important. So don't lie awake in bed worrying unnecessarily. Nothing is going to happen to you. If you take adequate precautions, nothing is going to happen to you. Please try and avoid these alarmist reports which you see on TV and on social media these days. Keep your mind off it. Remember, I would put my neck out and say 90% of the nonsense that you get on social media is false and is wrong. And you should never use your common sense, never follow it. Remember, do not watch television for at least half an hour to 45 minutes before you go to bed. Why? Because that blue light which you get, the blue light which you get is what is going to prevent you from sleeping properly. Remember, despite being confined indoor during the corona epidemic with all this gloomy news coming on all the TV channels and all the anchors shouting at each other, try and take up something which could help you. Try and do indoor games. Try and take up gardening. Try and take up cooking. Build up some hobby so that you have your routine, exercise, diet, yoga, and your hobby, so that you have something to look forward to. And that is why I say that you should have a positive frame of mind in these hard times. Remember, follow all the precautionary guidelines that have been laid down by the government and medical professionals. I repeat, guidelines laid down by medical professionals and the government. Do not rely on all that you see on social media. Most important, wash your hands regularly with soap and water for at least 20 seconds. The act of washing with soap and water should take at least 20 seconds before you rinse your hands off. Practice social distancing. I think that is important. It is something that we have to inculcate amongst ourselves because this thing is going to last for a very long time. By doing so and by following these practices, not only will you save yourself in the current pandemic, but you will also be doing everybody else a favor. So remember, stay at home, stay healthy, stay safe. Thank you very much.